Hi guys, I hope you are doing amazing. And today we'll discuss something about basics of umbilical cord banking, and that is very important. It is a recent advance, and we will talk about the important parts of umbilical cord banking. So we'll begin with our lecture of umbilical cord banking. So first and the most important part of umbilical cord banking is UCB. Umbilical cord banking is that you have to remember that why is umbilical cord banking so much in rage. So what are the advantages and usages of umbilical cord banking? So you should know that umbilical cord is a rich source. It is a rich source of hematopoietic stem cells. Hematopoietic stem cells. So you have to remember that umbilical cord blood is a very rich source of hematopoietic stem cells, and these hematopoietic stem cells have abilities of cell renewal, and they can also be differentiated into myeloid precursors, myeloid or lymphoid precursors. Both precursors are possible. They can be differentiated to myeloid or lymphoid precursors. So they turn out to be an excellent source of an alternative to hematopoietic stem cell transplant. As you know that we require 6x6 matching. 6 HLA matching is done in umbilical cord blood, while in hematopoietic stem cell we require 8x8 matching. That is the ideal matching. For umbilical cord it is 6x6 matching, and this is very important. So now, why are this? So first advantage is the presence of hematopoietic stem cells. Also, the umbilical cells have longer telomerase, longer telomer length. Now, as you know that aging is a physiological process. With time, we grow old, and then gradually our body dies. So, many people die of natural causes. So, why do we age and why do we die after certain age? So, it is thought to be, a very beneficial act, because again that if no one would die of the older age, then what would happen would be that there would be a population boom. So it is an act of philanthropy. It has thought to be an act of philanthropy that you die after a certain age so that you can give the resources that are present, the finite resources that are present on this planet, to the next generation. So one of the methods of aging is thought to be that the telomere length is shortened day by day. Telomere is a satellite DNA. Telomere is it is a part of the DNA which is all shaved off with telomerase. The telomerase activity takes off some part of DNA with every cell replication. So you do not have infinite cell replication. So until the telomere length is maintained, the cell can replicate. Once the telomere length, the entire telomere has been destroyed, the cell cannot be replicated. So with the longer telomere length, what is the benefit is that they help in long time hematopoiesis. It helps in hematopoiesis for long time, and that is the benefit of the umbilical cord cells. Also, the cord blood is a rich source of mesenchymal cells, rich source of mesenchymal cells. Now, what are these mesenchymal cells? These are the cells that are present in your bones, which are muscles. And this mesenchymal cell have a very good advantage, that suppress they suppress graft versus host reaction. Now, see, there are two effects of after a hematopoietic stem cell. So, what is graft versus host defect? So, consider that a patient X is getting a hematopoietic donation. A patient X, we have this patient. This patient is X. This patient is known as X, and this patient is the donor of the hematopoietic cell, and we have this patient who is Y. This patient is Y, who is the recipient. So imagine that this recipient. So as you know that in Y patient, we have to give immunosuppression to prevent the graft rejection. With all the transplant, we give immunosuppressive therapy to prevent the graft rejection. So the X patient gives his bone marrow to this patient. Now this Y patient who has gained the donor, who has gained the cells from the donor X, what will happen is the leukocytes, the white blood cells, which are actually the lymphocytes which mount this assault, lymphocytes, and these are usually alpha beta lymphocytes, and there are gamma delta which are helpful in graft versus leukemia effect. This is alpha beta lymphocytes. This lymphocyte mount an attack on the recipient, on the immunosuppressed recipient. So what happens is that this immunosuppressed recipient gets attacked by the cells of the donor, and what happens is that the recipient faces a huge attack, autoimmune type attack inside the body, which causes graft versus host reaction. So this assault that is mounted upon by lymphocytes inside a patient is known as graft versus host disease. The graft versus host, the graft attacks the host, and what happens is, see, if the host attacks the graft, it is known as transplant failure. The transplant dies. But if the transplant attacks the patient, then it is called as graft versus host. It is the opposite of transplant failure. And this mesenchymal cells suppress graft versus host reaction because they have naive T cells. Now see, this you have to understand that this cells of the donor, this alpha beta lymphocytes of the donor, have been sensitized against the foreign antigens, but the umbilical blood has naive T cells. They are not sensitized against anyone or any disease or any pathogen. So these are naive T cells which are very, very helpful to prevent the patient from having from having graft versus host reaction. So graft versus host reaction is never seen with umbilical cord transplant. So these are the important things, and the umbilical cord transplant have been used in malignant disorders, malignant disease, hematological disease, and storage disease, the glycogen storage or other storage disease. They have been used successfully, and they can be used for more than 15 years. We have very limited, the theory on this is very limited, but it has been thought that they are at least there for at least 15 years. So that is the benefit. The first umbilical cord transplant was done by Gluckman in a patient of Fanconi's anemia who is alive till date. Okay, it was done in 1988, and the patient is still alive till date. So that is very important. The first transplant was done on a 5-year-old child with Fanconi's anemia, and it was done by Gluckman. Okay. So now these are the features and advantages of umbilical cord blood. So now how do you do it? Process. What is the process? So first important thing that you should know about the process is that it is collected. It is collected at the third stage of labor. Third stage of labor is after the delivery of baby. After delivery of baby, or it can be collected in the fourth stage, which is after the delivery, after delivery of placenta. So this is when you can collect the umbilical blood, and this blood is actually wasted. So this has no harms. The collection of blood has no harm to mother or the child. Routinely, if the procedure is done carefully without any with the right protocols, they have zero harm to the mother or the child. And this is collected from the umbilical cord. The blood is collected from the separated umbilical cord, called by gravity method, by special personnel. Okay, special personnel. The personnel is trained in this. Why, I will tell you. And this this is collected by gravity in a special collecting bag, special anticoagulant collecting bag. Now, why is this collected by a special personnel? So it is very important to maintain asepsis in every step of the way. The maintenance of asepsis is very, very important, and you cannot risk 1% chance of contamination, because if it is there, then there might be a lot of problem. Also, what will happen is that you have to collect, because see, umbilical cells are finite. So these finite cells you have to collect very carefully, because if you do not collect them properly, then they might be unviable for usage. So that is why the proper method is very important. Plus, you have to maintain strict asepsis. Okay, now it is transported to blood bank, where it is tested. Processed, and cryopreserved. So this is very, very important. These all steps are maintained, tested, processed, and cryopreserved, and the blood volume and cell count may get decreased. Now, sometimes what happens is that these people are very smart. That okay, to decrease the chances of failure, what do they do is, we usually routinely follow delayed cord clamping. We, as pediatrician or all the gynecologists, we all follow delayed cord clamping. So what these people do is sometimes that they might do early cord clamping, and so that they can collect more blood from the umbilicus. So this is a very wrong procedure, and this should absolutely not be done. So early cord clamping is contraindicated, and this is the only harmful thing that might be done. So early cord clamping is not done. Early cord clamping is a very big no-no, and you have to remember that complicated pregnancies like twins, prematurity, in these patients also you should not do umbilical cord transplant, because here the time is on essence, plus it is a complicated delivery, and again complications might arise. So as of now, you should be very careful that in prematurity or twin delivery, you should not go for umbilical cord collection. Okay, so that is very, very important. Now, you also have to remember is that there is no benefit as of now of Wharton's jelly or placenta. So this should not be collected, because there is no benefit over here. Now, this umbilical cord blood transplant was initially done. It was initially done in matched children. Okay, so these matched children were around 10 to 15 kg. So for them, the umbilical cord blood transplant was enough. But in adults, one sample is not enough. You have to give two. One sample is not enough, because there are not enough precursor to repopulate the adult population. Plus, once you have given this umbilical cord blood, there is no way possible, if it fails, to retrieve it or to create more umbilical blood, because this is very finite resource. So once you have given it to the patient and it doesn't work, then that sample is wasted, plus the patient's money is wasted. So you have to remember that one sample is not enough. You have to give two HLA matched 6x6 HLA matched samples. Now, see, one matched HLA 6x6 sample is not available for many of the patients. It is very difficult to find two HLA matched samples. Okay, so for adults, it has a very limited role. And because of that, there is a very, very minimal role in adult. But in pediatrics, one sample is enough for 10 to 15 kg. One sample is enough to repopulate the cell. So that is why it is important. Now you have to remember that cord banking is done by private and public sector. So there are public banks and private banks. Now you have to remember that in public banks, the donors, there is free of cost. Donors are not charged any money. Storage is also free of cost. It is taken by the institute that is maintaining. But when you donate, or the recipient has to pay the money for processing and everything. So all the money is taken from recipient and he has to pay for the sample plus storage depending upon the public bank. So that you have to remember. Private bank, what do they do is, nowadays they are promoting that, okay, these private banks, these private blood banks are, what they are doing is they are telling you that you do not know that your child might have a disease in the future. So what do you do is you keep the sample with us. So donor are charged. In private banks, what happens is that the particular family, XYZ family, opts for this procedure to prevent or to as a safeguard against any future disease of the child. So what happens is that the donor is charged and the storage is also charged from the donor. But you have to remember that this sample is only available to the patient and his family. This sample is available, or the transplant is available only to family of the donor. Okay, so like the donor's mother, father require, or donor sibling require, then only the sample is given. But in public bank, it is available to all. If you want, it is available to you, available to all. Okay, so this is the difference between public and private. And obviously you might have guessed till now that private sector is booming. And why is it booming? And because of false advertising. So next step, we will see that what are the limitations of umbilical cord blood. What are the limitations? So you have to see what this umbilical, these people, what they do is umbilical, they market umbilical cord blood transplantation as a panacea, as a one treatment, ek dawai for all issues, one solution for all issues. So this is not the case. You have to understand one thing, that if a X baby has thalassemia and you collect the umbilical stem cell from that baby, the stem cells also have the beta thalassemia gene. So you have to understand that the genetic diseases which the child already has is already present in the umbilical cell. So you cannot give that to the same baby. If you assume that a patient has an elder brother, if a mother father are thalassemia trait, and their first child is thalassemia major, then what might happen is that they test their second child and the second child is not thalassemia carrier or not a thalassemia disease. Now this sample of the second baby they can use in the first baby, but the sample of the first baby cannot be used in that baby later on. So that you have to understand that autologous stem cells, like patient's own cannot be used to cure genetic disease, because the umbilical cell also has that genetic abnormality. So it cannot be used to treat the genetic disease that the patient has. Like you can give it to your other family member, but the same disease, it cannot be used. So that is very, very important. Also, as I told you, the T cells are naive. So T cells are naive. So there is no graft versus leukemia effect. Now, again, we will see the example of XY to understand what is graft versus leukemia effect. Now, imagine that this patient is X patient, who is the recipient, who is the donor. Okay, who is the donor, and this is a Y patient who is the recipient. Now, what happens is, as we saw, that this patient will donate to this patient who is immunosuppressed. Now, this patient has alpha beta lymphocyte that I told you, and this alpha beta lymphocyte of the X patient will cause graft versus host disease in the Y patient. But there are also a trait of gamma delta lymphocyte. These lymphocyte will attack, this lymphocyte of X, the donor, the lymphocyte of the donor will attack the malignancy that is haunting the patient Y, and this will cause an effect known as graft versus leukemia effect. What is this graft versus leukemia effect? The lymphocyte in the graft will mount an assault against the leukemia cells. As you know, leukemia cells are considered foreign. They are not normal. They are abnormal. So they should be phagocytosed. So this assault of the recipient, the assault of donor lymphocytes on the recipient tumor is called as graft versus leukemia effect. So as I told you, T cells are naive. So there is no graft versus leukemia effect in the patients with umbilical cell transplant. It is there. See, GVHD and GVLE both are seen with hematopoietic stem cell transplant, but they are not seen with umbilical cell transplant. So in patients in whom we are expecting that this graft versus leukemia effect will be beneficial, in those patients, umbilical cord banking has a limited role compared to hematopoietic stem cell transplant. So these are the two limitations you have to understand of umbilical cell transplant. Now, again, private banking, when do you do? Private banking, when do you do? So you imagine that you have this family suffering from thalassemia. Okay. This family is suffering from thalassemia, the mother and the father. Okay, let's assume they are consanguineous. Okay. So mother and father are carrier, and the first child they have is a male child who is a disease. Okay. So in this child's umbilical cell cannot be used. Excuse me. This child's umbilical cells also will have the beta thalassemia gene. So what will happen when they have the second child? The second child is unaffected. So when the second child is born, they can use this child's umbilical cell transplant to help this patient. The younger siblings' umbilical cord cells will be used to help the older siblings' disease. But the older siblings' own umbilical cells cannot be used because they are also carrying the disease. So you have to understand this, that this is not available. Autologous are not beneficial. Autologous transplant are not beneficial in genetic disease. You have to go for allogenic transplants. Okay, so that is very, very important, and you have to understand that this is not a stem cell treatment. This is an umbilical cord blood treatment. See, stem cell treatment is that they are panacea. They can be used to treat any disease. Umbilical cord blood cannot be used to treat any disease. They are used to treat disease in the same disease in whom hematopoietic stem cells are useful, but they cannot be used in patient's own issue if the patient is suffering from a genetic disease. So this is very, very important, and you should understand about this. And in some countries like France and Italy, this is absolute private cord banking is absolutely banned, because see what they do is they make a fool out of patient. They'll tell them that agar aapka bachcha future mein koi disease se suffer karta hai, so this will be the treatment. But it is not useful for treatment for in the patient's own genetic abnormality. So that you have to remember, and you should know all this abnormality. And it can only be used if the patient later on suffers from an acquired insult. In acquired insult, it might be used. So I guess that's all for today, guys. And I hope you like the video. And this was a very brief lecture. And this was mostly to make you aware. Plus, you can write a very good answer in exam. This is more than enough to write in exam. And this is the IAP consensus statement. This is the IAP ka own statement. So this is approved all over India. That's all for today, guys, and I'll see you in the next one.